and whether or not we're ready to roll out that vaccine to the population and what it would take. Now, the deadly COVID-19 virus is one which attacks a person's ability to breathe. The issue is the core reason why many ICU patients battling the disease are spending hundreds of thousands of shillings just to get supply of the precious commodity. But why is the air many of us breathe for free so expensive when it's used in the hospital? KTN's Timothy Otieno explores the intrigue surrounding Kenyan hospitals' quest to stock their facilities with medical oxygen and why COVID-19 patients are paying so dearly for it.
In a battle between life and death, air is the intermediary that accommodates a patient struggling to cling on. And for those fighting off the deadly coronavirus, the importance of medical oxygen cannot be overemphasized. At the Machakos Level 5 hospital, medics understand the need to have the precious commodity. Kanini Mudhama is one of the many patients who troop to this facility to get their weekly dose of the precious commodity. She has been living with asthma since she was a child.
Kama hakuna oxygen, hakuna watu wale wako na asthma hawezi kuwa, kwa sababu ukiwa na hakuna oxygen ni ndatika tu. Hiyo kifua ukifungua kwa nguvu huwezi nini kukua kama siku mingi, lazima ndatika waache dunia.
The oxygen Kanini and many others like her get from such facilities is the same one COVID-19 patients in ICU facilities are receiving. But the Machakos hospital says that it's not spending a lot on the oxygen for its patients. However, the facility spent close to 20 million shillings to develop an oxygen plant within the establishment. It's an investment that has cut down operational costs of buying oxygen down from 1 million shillings a month to just 200,000 shillings.
We have certain patients who require oxygen, those who have difficulties in getting oxygen to their tissues, and so we use oxygen that is supplemented by either from piped or from cylinders.
Medical oxygen is available in 4 different formats, either in oxygen cylinders, through oxygen concentrators, liquid oxygen generators, or through oxygen plants. Kenya has about 70 oxygen plants spread across 41 counties. In Makueni, close to 15 million shillings was used to install the plant at the Makueni Referral Hospital back in 2018.
We can do about 4,000 liters of oxygen in a day, which is quite sufficient for our hospital.
But the CEO of the Ruai Family Hospital, which also heavily uses the medical oxygen, says the costs for COVID-19 patients is becoming unbearable.
On a normal day, a patient who's on high flow oxygen would need between 2 to 3 cylinders. COVID-19 has pushed this consumption higher because they're purely dependent on oxygen 100%. So you find they use about 3 to 5 cylinders per day. This is about, if you convert it into liters, it's about, they spend about 19,000 liters of oxygen. That's 8,500 by about 5. 40,000 liters of oxygen per day, yes, on one particular patient.
The COVID-19 pandemic has increased the use of oxygen in isolation centers across the country since the virus attacks the lungs' ability to supply air to the body. COVID-19 patients with underlying conditions consume at least 60 liters of oxygen daily.
We found that the 15 million that we used and the amount of money that we are able to save in a month, they are just 2 worlds apart. In fact, we are able to save about 11 million every month when we have our own machine here, as compared to buying.
With independent oxygen suppliers having hiked oxygen prices, more and more health facilities are opting to have their own oxygen plants. Still, that hasn't reduced the costs of buying medical oxygen, which is 100% purified as opposed to the oxygen we breathe naturally from the air. Meaning, patients like Kanini will still have to dig much deeper into their pockets for that vital puff of fresh air. Timothy Otieno, KTN News.
Great, let's go back to that story by Bildin Waliaulen. She was asking, is Kenya ready to roll out the vaccine once its efficacy has been established? What financial ramifications does it portend for Kenya? And what does it take to roll it out to the